live close to Moratuwa. So they know that, right? Okay, so do we have people close to Moratuwa? Do we have? No. Okay, Moratuwa, Piliandala, do we have? No. Okay, so I don't know, but the thing is, we have a kind of terrible power cut, and I waited, but it's not restored yet. Okay, you are not from Moratuwa. You are not so close to like this area. Then you don't know. Okay, no worries. But I can do the class with you, but the thing is, I'm not able to switch on my camera because it's dark here. Okay, that's why. Okay, so fine. How do you need like me to do the session today? I mean, do I need to speak in Sinhala a lot or do I need to speak in English a lot? Because today we are not going to do the introductory session. Today is our very first day. Okay, so then how do you like me to do that first? Yes, quickly tell me. You feel like it's better if I explain the things in Sinhala as well? Okay, or yeah. Yeah, you can just switch on your microphones and tell me. If not, you can just drop a message. Whatever you feel comfortable. Okay, what's your idea? We can use full English. Okay, nice. English only. Very good. Okay. Yes, everyone. Okay, you are very free to answer. Okay, there is no, I mean, yeah, you are very free here. You can just give me any answer as you feel. Okay, nice. So then I got three answers like we will use only English. Okay, then others, if you have a different answer, quickly drop a message. English only. Okay, fine then. Let's do that. Okay, English only. Everyone's saying English only, right? Okay, then let's do. Now I'm going to share my screen. That is about any guesses? So I told you that day when I was doing the introductory session, OET comprises four parts. That is speaking, reading there, writing there, and like listening there. So guess and tell me what is our lesson? Okay, so am I going to do speaking one or a writing one or a listening or reading? As you feel, as you guess, okay, you can just have a like a kind of guessing today. Okay? Yes, any guesses first? Do you have any guesses? What am I going to teach you today? I selected a very special part today to teach you. Okay, so do you have any guesses? Guesses another. Ah, okay, so some saying it should be writing. Okay, okay, so nice. How about other guesses? Yeah. So some think it like probably she is going to teach writing today. Okay, nice. Other guesses? Speaking. Uh-huh. Okay, nice. Okay, how about others? You all have to guess. Okay, guess and text me and yeah, yes, because we should have a good interaction when we are learning, okay? Because we are going to do this online and then we should have a good interaction between each other. So if not, you feel boring for sure. So just try to type your answers and just try to speak up in the class. Okay, then you don't feel somewhat isolated or lonely. You feel like, okay, so then I'm listening to this person. Okay, listening. No, no, that's about, yes, you guessed it correctly. Some of you guessed this correctly. Now you will see. Okay, so this is our lesson, and that is, yes, speaking. Okay, I wanted to start this with the speaking students because I recently received one of my students' results. Okay, and then speaking one, actually, she had only I can't remember. As far as I can remember, she had only 1 month to prepare for the exam. She had 1 month to prepare for the exam. So due to that factor, like then wait, I will show you her result sheet. Okay, so then I have a kind of reason why I selected speaking today. Okay, among other speaking select kare me reason එක නිසා. So actually, I can't show you whose test is this because this is just like you, just like she's also working as a nurse. Okay, so this is her result. She wrote the exam. So that is just 2 weeks ago, she wrote the exam and then she received her results. So this is about her result. Okay. So listening, she got 220, reading 230, speaking 355, and writing 300. Okay. So that means like it's somewhat better, but the thing is 350 is the limit, students. Most of the times, as I told you that day, 350 is the B limit. So at least we should have a B pass there. Okay, but here she got C for listening, C for reading, and C plus for writing. Okay, so she passed only speaking one. So no, passed in the sense she passed, but the thing is she doesn't have D and E, that is the limit. But she got C, C plus and B. But it is better if we can make it as B's there. Okay, so if like listening also here, then reading also here, and writing also here, then that becomes something excellent for sure. Definitely that is going to be a kind of excellent result, but she received this. Yeah, okay. So after your exam also, so your result sheet will also be just like this. Okay, I mean, just like this in the sense, not like listening and not like that, but the marks will be different. But I mean, you will be receiving this kind of chart as your result sheet. Okay, so this is no, she's going to write the exam again. I think she had only 1 month to prepare, because I think that's the reason why she received low marks for listening and reading, because listening is too hard when compared with other things. Okay, but we'll practice. Speaking is okay, but the thing is we need to practice speaking a lot. Okay, so let's try our best, and that's the reason why I thought to start with speaking today, because I felt interested in teaching speaking first. Okay, fine. Hope you got a kind of idea about why I selected speaking today. Okay, it is just because of my student result. Okay, nice. And the other one is, okay, so this is our lesson one. And first we are going to teach, that is question types. Okay, this is our lesson today. Question types are really important, students, because we need to understand what kind of questions that we should ask from the patient or the caretaker or like anyone else. So we, like any person, when we are engaging in a conversation. Okay, so that is about when you have, like, think about you have a conversation with me. Okay, then you need to understand, okay, so what kind of questions that I can ask from this person. Okay, how am I going to start the conversation? Because OET speaking, that consists of two role plays. Okay, we have two role plays. We have two role plays. Role plays dekak tiyanava. So then we need to understand, how am I going to initiate the role play? Because you are the person who should start the role play. Your examiner is not going to start. Okay, so you have to start your conversation, then the examiner will be answering, and examiner will be asking you questions. Okay, that is how the role play starts. Anyhow, it is better if we can practice question types today. Okay, so this is our lesson. Hope you got what am I going to teach you. Okay, these are the lesson objectives. Today we are going to learn four different types of questions. We have short questions there. Okay, I will explain one by one, no worries. Short questions, long questions, tag questions, indirect questions. Only these four question types we are going to learn. And other than that, I am not going to make you exhausted. I know that you feel stressed or with the works, and I know it's too hard. But let's try our best to learn these four question types today. I don't want to make you tired, okay, because we will learn it in a kind of good way. Another thing is, then I will teach you how to formulate the question. That is about how to make these questions when you have patient interactions, okay. And other thing is, when you are asking a question from a patient, you should think about your professionalism. Okay, because you are a healthcare professional, right? Okay, I mean, you can't just ask the questions in a very simple way, So no, you can't be like that. You should be very professional when asking the question. And it should be clear. Clarity means another word for clear. Okay, so your question should be very clear to the patient. If not, your examiner will ask you, sorry, I don't understand what you say. So can you please repeat it again? Okay, so don't make yourself into that situation. Okay, because when you ask the question, please make sure that you are asking it very clearly from your patient. Your patient is your examiner. Okay, yes, no one is there. Your patient is your examiner. Then other one is I am going to teach you the difference between direct and indirect question. Okay, so what is the difference between how do you feel? Can I know how you feel today? So now I'm going to teach you that difference today. Okay, direct and indirect question. Other one is like we will practice some questions, but you have a kind of assignment, take home task. We'll do it later after the class. You can do it later because I know it will be somewhat harder for you to do it in the class today. You need to study it further. You need to study it alone, and after that, try to do that task. Okay, then I will send you a link to post your recordings. Okay, fine. Are the objectives clear? What we are going to learn today? Do you have any doubts about objectives, students? Or is that clear? Sorry, actually, I'm very sorry that I'm not able to switch on my camera today because still we don't have power. It's not restored yet. Yes.
It's clear.
Okay, nice. It's clear. Okay, just clear, clear, or crystal clear. The objectives. Just clear, clear, or crystal clear.
It's clear.
What can you say? Crystal
It's
clear.
clear. Yes.
Okay, crystal clear. Nice. Okay, we'll understand those things. Later, අපි ඉගෙන ගමු. So, what's the difference between these things? So, okay, why do we use just there? Why do we use bit there? These are really important. Why do we use quite there? Why do we use pretty? Okay, yes. So, if your patient say, I am pretty okay. Okay, then you should understand this thing. If your patient says, if your examiner says, oh, okay, I'm pretty okay. I'm just feeling fine. I'm bit okay. So then you need to understand the difference between these. Okay, so actually you will be able to learn a lot of English. Yes, I mean, you will be able to polish your English to the best because that's also something very nice. It's a good chance that you have, okay, through this. Okay, because that is occupational English test. Then you are going to polish your English through that. Okay, nice. Then, yeah, this thing I have already explained you that day. This is your speaking task. Okay, and this is how like the examiner giving you the role play. So you have 3 minutes, students. Okay, so you have 3 minutes to read this part. You have 3 minutes to read this part. After that, you have to start the conversation. Okay, so look at this thing. A young boy, age 4, was admitted to hospital through the children's emergency. Department for acute. So what's this meaning? Yes, how to pronounce this? Everyone try to pronounce this. So these are the terms,
Meningoencephalitis.
okay? Yeah, yeah, try to pronounce.
Meningoencephalitis.
Yeah, okay, very
Meningoencephalitis.
nice. Okay, others also try. Try. You all should try. Okay, if it is harder to pronounce, look, if you will have this in your exam, how are you going to pronounce this? This is what I told you. The medical words are really important. Okay, yes.
Meningoencephalitis.
Okay, nice, excellent. Others also try. I can hear only few words there. Everyone try.
Meningoencephalitis.
Yes, meningoencephalitis. Excellent. So that is like if it is harder, just divide it into chunks. Okay. So meningoencephalitis. Meningoencephalitis. Okay, that is it. Okay, then if you feel somewhat harder to pronounce, then the examiner feels like, okay, so this person doesn't know even to pronounce this term, so how am I going to give marks to this person? Okay, so you can't be like that. Then, as a result of a complication following, okay, isn't it recorded? Wait, I will record this for sure. Because if not, no, if I record, then you will be able to listen to this again and again. No? Okay, wait. Okay, now it's, I think, recorded. Then you can listen to this later as well. Okay, nice. Yeah, and the other one is because these are really important. I feel like it's better if you can listen to this recording again. That's why, as a result of a complication following mumps, he has fully recovered and is ready to be discharged home. So you like they will give you a pencil as well. So now you need to underline these kind of things. You need to understand what kind of person is here. His parents are unaware that a vaccine is available in Australia, which protects against mumps. They would like further information. So now you are not going to talk with this boy. So you are going to talk with their parents, right? Okay. They also have a 2-year-old son and have only lived in Australia for, like Australia, 6 months. Okay, so this is the scenario. Scenario means the context. That is about your situation, not your situation, the situation given in the role play card. That is the scenario. Okay, we call it as role play scenario. Okay, so now you understood your scenario. That is, you have a like a patient and a child patient there. So that's a boy aged 4. Okay, and now you are going to have the conversation with their parents. Okay, so now your examiner will be the parents of this child. Okay, so then your task is to explain to the parent that the boy has fully recovered. You have to explain them that no worries, like your son will be okay. Then make him or her aware that like the importance of full vaccination. Then tell them what vaccination is required, when to have it, and then inform them. So when doing all these tasks, you need to understand how to ask a question. Okay, that is really important. So you can't just give information like in a very quick way. So you need to have pauses there. Pauses in the sense pauses. That is about pauses in the in Sinhala we say that is about like product navati nona, right? So navatila you should have pauses there. You ask questions and then sometimes they will ask you questions. Then you need to answer them. Okay. So in this scenario, it's better if we can have a good understanding about the question types. Then we know how to start the conversation, what should I tell in the middle of the conversation, and how can I end the conversation. Okay, because you have to talk with this examiner for 5 minutes. Okay, it is a 5 minutes conversation. Okay, so the examiner says you if you exceed 5 minutes, then they will like she or he will say, okay, so your time is over. Now let's stop. Okay, so then you should have something to talk for 5 minutes. Okay, then it is better to understand how to ask questions. Okay, do you understand the importance of question types lesson now? Is that clear to you? The reason why we are doing question types? Yeah, students, is the reason clear to you? What's the reason why we are learning question types for OET speaking? Is that clear? Yes, everyone. Drop messages, no worries. Okay, you can just drop me messages. Okay, yeah, you understood the reason. Okay, yes. Okay, nice, understood, right? Okay, now what you need to do is I am going to show you a video. Okay, so we are going to watch a video. While watching this video, you have to write down 5 questions that the nurse asked the examiner. Okay, so now this nurse is asking some questions from the examiner. You have to listen to this role play very attentively, okay? And then you have to write down 5 questions there. Are you ready? Can I play this? Are you ready, or do I need to tell the instructions again to you? Or are you ready to watch the video?
We are ready
Ready.
to watch the video.
Okay, well done. Nice. So then let's start. Okay, so now you could see how this is going to happen. Okay, so now you are just listening to this thing, listening plus watching. Okay, and then you have to write at least 5. At least 5, because this will be probably 3 minutes. Okay, yes. So now I'm going to play the video. You need to listen this really well. Okay.
Thank you.
Okay, nice. So fine. So look at this and listen to what they say. So this is real OET thing. Okay, so your exam will also be like this, and we will be able to improve our syllabus. Okay, let's try. Now listen.
Let's move on to the role plays now. So I'll take the part of the patient or perhaps a relative. You'll take the professional role. So each role play will last 5 minutes, and the purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, thanks.
Excellent.
Okay, can you see? So the examiner is going to play the role of the patient, and nurse is going to play the role of the nurse there. Okay, so now they are going to start the conversation, and examiner is giving this nurse or the student 3 minutes to get ready. Okay, let's see.
So you have up to 3 minutes to prepare the first role play. You will start the role play after that time. You'll know when 3 minutes are up. You can ask me if there's anything you're not sure about, and make notes on the role play card if you want. There's a pencil for making notes. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the first role play, and the role play number 1 for profession of nursing. Please start preparing now.
Can you see? So then she is given the chance to use the pencil to write something, or to jot down notes there, or to underline. Okay, so yeah, let's see. So now she is underlining. Okay, so she also received a same kind of scenario, just like I showed you early.
Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now?
Can you see?
Yeah.
So can you start the role play now? That is about, the nurse should start the conversation. Okay, let's see.
Hi, my name is Mary. I am one of the nurses from the hospital. I came today because the doctor needs you to start insulin. So, what do you feel about that?
Well, to be honest, I'm a little bit nervous about the idea of starting insulin injections.
Oh, okay. I can understand it's really new for you to inject yourself with insulin, but I'd like to reassure you that it's easy and it's straightforward. So I will explain to you how to take the injection, and you will be fine. So, yeah.
Is there any other way? Is there another thing we could possibly do?
About the diet and anything oral tablet, I think it's not the good option for you at the moment, because your the diet is not controlling your the sugar level in your blood. So the insulin injection is the best option for you at the moment. It will control your blood sugar level and bring your blood sugar level at the normal level for you. So I want to reassure you that it's very easy to take insulin injection, and I can explain to you how to take it. So can you let me to tell you?
Yes.
So in the beginning, you will take the insulin injection. You open it and check the correct dose and the date of on the needle, and if it's right and if it's the right dose, the doctor tell you, and then you check on your tummy. So choose any spot you like, and then try to squeeze your tummy like this, and then put your needle. But I would like to explain that you need to change the spot. So you don't use the same spot for every time. So you need to change the spot. One time here, one time there, so you don't have the bruising and this kind of painful area. Yeah. So what do you think about that?
I mean, I guess, as you say, I have to because my diet isn't working to control my insulin. I still feel a bit nervous about it, but I guess I could give it a go.
Yeah, and the insulin injection will control the situation for you, and you will get healthier and better, and the insulin will help you get better and improve your condition, make you feel healthier and good again. Yeah.
Is it something I have to do for the rest of my life? I mean, that's, I guess, also something that I'm kind of nervous about.
Yeah, you will take this injection, and the doctor will keep an eye on the blood sugar level. So you will have to do a test for every couple of months or something like that. The doctor will tell you exactly, and then you will check your blood sugar. If one stage your blood sugar will become normal again, so maybe the doctor will explain to you another option. But at this stage, you need to take the insulin injection to help your condition. And I would like to stress the importance of disposable to through the needle.
Okay, so I feel like that's enough because we have been listening to this thing for 5 minutes now. I felt it like that's enough. Okay, so were you able to write some questions, students? The questions that this particular nurse asked from the examiner? Were you able to write some questions? Yes or no? What do you feel about it? So, do you feel confidence? Okay, so I mean, do you feel confident to do this? Now you have, you got a kind of understanding about, so this is how it's going to like happen. So how about your idea? So do you feel okay? So I feel like I will be able to do this speaking test, or how do you feel about it? Yes, you feel somewhat confident. So any answer? We have time. Okay, we have time to practice. But now, like, just tell me about what you felt about it. You felt confident or you felt somewhat demotivated? Oh, yes. How was it? You felt confident. Okay, very nice. How about others? You also felt somewhat confident after listening to this? Okay, nice, nice. That's okay. Fine. Yes. So now, just tell me what kind of questions you wrote here. Yes. So can you please come up with the question types you wrote there? Okay, yes, quickly tell me. Somewhat troublesome situation about my band. Okay, no, it will not be a trouble for sure, but you need to practice it. Okay, if you have a good practice, it will not be that much of difficult you to face. Okay, because like A2 level students also sometimes do it in the better way. So I feel like yeah, because speaking part anyone can manage if they have the confidence and practice. Okay, if they have the confidence and practice, they can do that. Okay, fine. Yes, so did you write the question types? Were you able to write the questions there? No. Any answer? You forgot. Oh, you were unable to understand the question types. What happened? Okay. Only three. Okay. That is also enough. Okay, that's very good. Only three also enough. Okay, anyway, you wrote me at least one. Okay, yeah. So now we are going to identify question types. I told you there are 4 question types that I am going to teach you today. So, one is, do you feel any pain? You are feeling better now, aren't you? Could you tell me how long you have been experiencing this pain? Can you describe the pain you are experiencing in detail? Okay, so as you feel, what is the short question? A, B, C, or D? Yes. So now I need you to tell me the short question. Where can we see the short question? A, B, C, or D? You can guess, huh? First, you are going to guess these things, students. Okay, there might be like, there are not like nothing like right or wrong answers. Just give me the answer you feel. That is fine because you are learning now and this is new to you. Okay, so just tell what you feel. No worries. Okay, yes, because you are learning. Okay, so you feel like A is a short question. Very good. That's nice. A is the short question. Okay. Then what is the long question? What is the long question as you feel? B, C, or D? A now we can eliminate. That is a short question. Then what is a long question, students? D. Okay. Fine. So you think it as D, right? Okay. So D means long. Are you very sure about it? Or do you have different answers? C and D both. C. No, that is D. Okay, so D is a long question. Okay, very good. Then, what is the tag question? That is easy. That thing you should know. What is the tag question? Just like a tag. Okay, sorry, TAG, huh? Okay, what is the tag question? Yes, that is there. That is obvious. So that is B. B is the tag question. Then indirect question is C. Okay, C is the indirect question. Okay, so now I am going to teach you these question types and how to form them. Okay, so now you got a kind of understanding about this presentation will be sent to you for sure after the session. Okay, now also I can send it to you. Okay, but now you can see it on the screen, then I will send it after the class. Okay, yeah, no worries. Then this is a short question. Like B is a tag question, C is an indirect question, D is a long question. Okay, so hope you understood the structure. Okay, but I'm going to teach one by one now. Okay. Um, Meaning of, okay, so that is tag in the sense TAG tag, tag question. This is there, TAG, it is not E there, tag, TAG, tag questions. Okay, I will explain. We are going to discuss these things in detail later. Okay, yeah, so these are the types of questions: short or close question, long or open questions, tag questions, and indirect questions. Okay, first one is short questions. Short questions means they require yes or no answer most. Okay, so probably when you start your conversation with the examiner, I would say patient there. So you need to remember, if I say patient means that's about your examiner. Okay, so you should like ask yes no question from your patient, because some patients, they do not like to give answers. Okay, if you ask what or something, that kind of question there, a long question there, probably it will be harder for the patient to give you an answer. Okay, so when you are starting your conversation, better to start using a short question. Okay, because short questions need a very brief, clear answer there. Okay, very often a single word, because the patient needs to come up with a very single word for a short question. Okay, then it's easy for you to start the conversation. Okay, so then you also feel comfortable and the patient will also feel comfortable if you ask a short question at the very beginning. Okay, so it will not harm your flow. Okay, so your flow will smoothly happen if you ask a short question there. Okay, so the like here, this is the way that you can ask. You can ask it using do there. Do you have any allergies? Okay, are you taking any medication? Is the pain getting worse? have you taken any medication recently? Can you say that? So then we use their do, are, is, have. Okay. So generally, these kind of auxiliary verbs can be used when you want to ask a short question. If you want to know or if you want to get only an yes no answer, this is the way that you should ask the question. Okay. Do you have any allergies? Are you taking any medication? Is the pain getting worse? Or have you taken any medication recently? Okay. But sometimes short questions means, so if they give you a very direct answer, they are also short questions. For example, where exactly do you feel the pain? That's about kohinda pain ikinne. So then I feel the pain in my lower back. Okay, that is also a short answer, no? So I feel the pain in my lower back. So the answer is very direct. Okay, so then we call it as a short question. When did the symptoms start? When did the symptoms start? The patient will say, the symptoms started 2 days ago. So these two answers are very direct and very brief answers. Okay. So we call these kind of questions as short or close questions. Okay. So generally we should have a kind of very direct or yes no answer. For example, Hitanna, think you want to you want to know only yes no from your patient. You don't want many details. You want only an yes no answer. Then you can ask do you or are you, is or have. Use one of these and ask that question. But imagine you want a kind of one word or a kind of very direct answer, very direct, but the thing is somewhat short answer. Then you can ask something like this. When did the symptoms start? Just 2 days ago. Okay. When did you take the medication? Just a week ago. Okay. So where exactly do you feel the pain? In my right hand. Okay, something like that. So they are very short phrases, and then the examiner also will feel comfortable into when talking with you. If you start your conversation with a short or close question. Okay, is that clear about short questions? Do you have any doubts about short questions, students? Or is that clear? What's your understanding? Okay, do you have any questions? You can ask if you have. Okay, you can just switch on your microphone. Okay. Yes, unmute yourself and ask. No worries. Okay. It is clear. How about others? Okay. Others, if you feel something doubtful or you want some clarification, just ask it. Okay. Nothing. You understood it properly. Okay, it is clear. Very good. So this is the way you have to ask it. Okay, but yes, no, it is better if you start like that. Then that is okay. It's a good start. Then, okay, so the second one is after that, let's do some, indirect question practice there. We will practice them. Okay. Yeah, so the first one is, yeah, short questions there. Now look at these short questions. What time do you go to bed? That is a very short question, right? What time do you go to bed? Then we can say, the patient can say, at around 11 p.m. every day. Okay, so you know the difference, right? When the patient say at 11, that is about hariyatama at 11. So patient, that is sleepy time. Okay, sleeping time. Okay. If it says at around 11, so that is about, it might be 11:05 or it might be 10:50, 10:55 or 11:10. So that is at around 11. Okay. If the patient says it sharp 11, so that is about very sharp, that is 11, we have to write PM there. Okay, 11 PM. Okay, so that is how we have to understand it, at 11, at around 11 or sharp 11. Okay, yes, so something or from if there are two time slots, so then that from 11 to 4 p.m. 4 a.m. every day. Okay, so that is from 11 p.m. to 4 p.m. every day. So like it differs. Okay, so the patient can come up with any preposition there, at, from, to, or anything, but you need to understand so the meaning of this particular thing. Okay, yes. If not, I can say I go to sleep. Yeah, this is okay. That's enough. Okay, so now at around 11 p.m. every day. Are you feeling better? Yes. Do you have cough? Yes, sometimes. Okay. Have you had this condition before? No, I haven't. Does the pain radiate anywhere else? No, it doesn't. Okay, so now you look. So this is how easy this is. That is, when you ask this kind of question, it's really easy for the patient to give the answer. Okay, and that increases the interaction between the patient and the nurse. Okay, because then they feel somewhat comfortable uh, when talking to you. Okay, so hope you understood what I said so far. So just try to understand this structure a lot when answering, like understanding a question, or when asking a question. Okay, then we'll move on to long questions. Long questions in the sense that is about, okay, long or open-ended questions. So they need detailed responses. So when you want to ask a long question from a patient, that means you want many details. It is not all about yes, no. Yes, no will not be enough for you. You want something more. Okay, then you can ask it using a long question. Okay, so for example, how has your condition changed over the last few days? Okay, look at the method. So that is, how has. Okay, how has your condition changed? Okay, so that is written in present continuous. Okay, since you asked me to explain only in English, then I don't tell it in Sinhala. Okay, how has your condition changed over the last few days? Why do you think the pain gets worse at night? So why do you think? So this is a good way of asking a long question. Okay. Then can you describe, or could you explain? Okay, you could hear that. Okay. So that is about when we were watching the first role play, you saw that particular nurse. So she used the term would a lot there. Would you be able to tell me? So this is a very nice way. Would you be able to tell me how often this happens? Okay. Can you give me more details about your medical history? So these are long or open questions that we can ask from the patients. Okay. How has your condition changed? What do you think? Can you describe? Could you explain? Would you be able to tell me? And can you give me more details? Okay. So this is the way you should ask more details from the patient. So that is not like yes, no. Now I think you can see the distinction between short questions and long questions. Short means yes, no answer or very direct answer at the end. Long means you are expecting a very lengthy or a detailed kind of answer. Okay, you want to know more details about this. Then you should ask a long or an open question. Okay, is that clear? Open questions or the long questions? How do you feel about it? Yes. Any doubts? If you have doubts, please ask. Okay, no doubts there. Quickly tell. If you don't have doubts, then say no, no, we don't have doubts. If we have doubts or problems, then say yes, we have problems. Do I need to explain anything? Something more? No, nothing there. Yes. No explanations needed. Yes. Shall we ask it from Natali? Yes, Natali or Madhushika? Anyone? Kushani? How about it? Is that clear to you all? Okay, it's clear. Nice. Okay, then we'll do a task. Now you told it's clear, ne? Okay, now I need you. So now your thing is you are a nurse in a clinic. Okay, and a patient has come in complaining of a stomach pain. So you have to ask questions to gather more details. Okay, so you should come up with 3 short questions and 3 long questions. Quickly do that. Yes, send your answers to our WhatsApp group, or if not, send your answers to Zoom chat box. Anything fine? Then we will discuss your answers. I am giving you 5 minutes. Okay, so now you understood short questions and long questions there. Short questions always expect yes or no, okay, or very direct answer. Long questions, so they are not like that. They expect you to like have more details. Okay. Do I need to send this presentation to the group? Or can you remember this? What's your idea? Is it better if I send it to the group right now? Students, how do you feel? Yes, quickly tell. What do you feel? Do I need to send it now or you are okay? You are okay with writing the questions without the presentation?
Mm,
Huh? Yes,
okay,
Kushani.
okay with writing questions without.
Oh, okay with writing without the presentation. Okay,
Yeah,
nice. Then write. Yes, very good. Yes.
but I don't know
So you
about the
should
others.
try. Hmm?
I don't know about the others.
Okay, how about others? Okay, no others. I gave them the chance to talk. Yes, others also can come up with your opinion. Okay. Yes, how about others? You need the help of the presentation? Oh, now you understood what I said and you are able to do it. How do you feel? You need the presentation. No, no one is talking. Then that means you are able to write it. Okay, nice. You can try. Okay. Yes, just type your answers. So we will introduce you the Moodle until that moment. Okay, just type your answers in our WhatsApp group. That's okay. Yes, drop your answers there. Okay, you have to come up with 3 uh, short questions and 3 long questions. So for the role play 1. Okay, so you are just dealing with a patient who is complaining of a stomach pain. So what kind of questions you can ask from this particular patient? Okay, yes, no thing. After that, more detailed things. Okay, put one by one. Yes, no worries. You can do mistakes, okay? There are no right or wrong answers when learning. Do mistakes because we are learning. Okay, I know that you are professionals and then sometimes this is going to be somewhat harder because we are dealing with another thing, another field. Okay, then no worries. Okay, we have one. Okay, so I'm just pasting your answers here. Okay, so very good. We will paste all of your answers in a Google form. Okay, then you can just go through it later. Yes, quickly do that, everyone. So this is your very first day. You feel somewhat harder because you first time learning this thing. That's why. Okay, so these are the answers I got. That is, at what time do you feel severe pain? Okay, short question. Which area do you feel severe pain? Have you had this before? Okay, yes, very good. So these are short questions. At what time do you feel severe pain? I can say, during night time. Okay. Which area do you feel severe pain? So my right hand. Okay. Then have you had this before? No, I haven't. Okay. Very good. So these are short questions. Nice. Others also try like this. Very good. Huh? Who wrote this? That's nice. Mm-hmm. Okay. Yes, try. Okay. These are Pavani's answers. Okay. Excellent. Okay. We'll type it here. Okay, quickly write. Others also come up with your answers. Okay, nice. So I got another one. Do you have recurrently pain after eating? Okay. Yes, that is this name. So you have to write it like we'll make some changes there. That is, do you have recurrently? Okay, so do you have pain after eating recurrently, or do you have recurrent pain after eating? Okay. Yes. Okay, I'm changing. Yes. Do you have recurrent pain after eating, or do you like recurrently at the end also you can use? No worries. Okay. And the other one is, what did you write? Nice things there. Do you feel pain at this time? Very good. Okay, so do you feel pain at this time? Yes. And the other one, how many times you feel it? That is like how many times? How many times now? That is you have to use have you, no? Or how many times have you? Or do you? Okay, how many times do you feel it? If not, you can ask it like, how many times have you felt it? Okay. How many times have you felt it? Okay. Can you tell me the place where it is started? Okay. Place where it is started. Nice. Okay. Yes. Very good. Yes, so last one, it is a kind of, we can't say short or long, but it has a direct answer as well. Ne? Can you tell me the place where it started? So it is at like a particular place, but it has a lot of information. Place plus something else. Okay, nice. How about others? Try your best to write. Everyone try your best. Okay. How feel the pain? Okay. Nice. So that is about, how about your pain? Okay. Or how do you feel the pain? Is the pain dull or is the pain sharp? Okay. So a lot of pain types there are neither. Some pains are dull pains and some pains are very sharp pains also there. Okay. You can ask it. Okay. You can ask. So how about your pain? Is it dull or is it sharp? Like that you can ask, ne? Okay, very good. Well done. Others also try. How to ask it? Just send me as you feel. Okay, because now you should understand the question type, no? Okay, so like don't be frightened, or it is all about you are typing the question. Okay, that is enough. Okay, so doesn't matter if it is correct or wrong. Just type your question here. Okay, that's all. Okay, that's enough. So first one is, at what time do you feel severe pain? So short question. Then we have you had this before? That is also short. Which area do you feel severe pain? That's also short question. Okay, so those things there. Very good. Huh? Okay, so fine. And other one, we are moving on to the last two question types. That is about like tag questions and indirect questions there. Okay, so tag questions in the sense that is about we are actually a question is tagged at the end of the statement, as you can see here. So these question tags are more common in speaking than in writing. So when writing, we don't use lot of these kind of tag questions, but especially when speaking, we can use tag questions there. Okay, for example, you are feeling a bit better now, aren't you? So first you are coming up with a sentence. Okay, so you are writing a sentence first. You are feeling better. Okay, that is a sentence. Then after that, you are writing the opposite one. That is, you are there. So then here you have to write, aren't you? Okay, hope you understood. That is about you are feeling better, aren't you? Okay, so that is about like if you write positive here, like after comma, you have to write it in negative form. Okay, you can't ask you are feeling better, are you? Then that is incorrect. Okay, it should be you are feeling better, aren't you? Okay, that is how you have to ask it. Okay, If you are writing something in a negation or no form there, you haven't taken any medication or you haven't taken any tablets. Okay, then you have to ask, have you? Okay, the reason is, first we have used here, you are feeling better, then aren't you? You haven't taken any tablets, then have you? You understood? So this is positive, then here that is negative. If this is negative, after the comma, the tag should be positive. Okay, so this is very easy if you practice. Okay, because what you need to remember is always if you are writing the sentence form like the first part in positive form, here make it like negative, aren't you? If it is negative, make here positive. You haven't taken any tablets, have you? Okay, yes, and we have some other examples also here. You have experienced this before, haven't you? Okay, it's not too painful when I touch here, is it? Okay, it is not too painful when I touch here, is it? You know how to take this medication, don't you? Okay, so they are very nice, no? Okay, so you can tell, I can tell you, students, you know how to do this. Then, don't you? Yes. Students, you know how to do this, don't you? Okay. Yes, so that is how we have to make tag questions. Okay. Do you understand? Is there any doubt there? Do you have any doubt?
Understood.
No doubts. Okay. Then can you please write 2 tag questions quickly? Okay, so the same person, the person who is having that stomach pain, quickly write tag questions, 2 tag questions. Tag questions are really easy. Okay, you are writing the phrase first or the sentence first, then you are putting comma, then writing that the negative part or the positive part. Okay, yes. Quickly write. Don't start with the question mark. I mean, is, never start with them. So you have to start with the sentence. You or like something. Okay. Yes. So most of the times we have to start with you there. So now you are dealing with that stomachache person. Okay. Stomachache patient. Then you can write something. Okay. You are feeling, I am writing one example. You are feeling uncomfortable, aren't you? Okay, this is how you have to ask. You are feeling uncomfortable, aren't you? Okay, yes. Try to write some 2 examples like that. Quickly type. Oh, I like if you can tell me. If you can speak up in the class and tell me, I feel it's better. Okay, because yeah, that will be better, students. Okay, you have always severe pain. Have you? No, that is incorrect. You should understand. Okay, yes, that's incorrect. So it's like this. Again, look at, have you always, sorry, you have always severe pain. So then what should write here? Can we write have you there? Yes. Can we write have you there, students? No, can't, ne? It should be haven't you. As I told you earlier, it's always the difficult, the opposite one. Okay? You have always severe pain, haven't you? Okay, nice. Again, try. Ah, very good. Okay. So that is there. That is about, we can just write, you have experienced recurrent pain, haven't you? Excellent. Okay, that is it. You understood, no? Okay, so yeah, no need to use have always. Just use anything you like. Or you know this. Okay, something. Okay, you
Are
know
you
this
feeling
method,
better in
don't you?
night time? Aren't you?
Sorry.
Are
Yes,
you feeling better in night time? Aren't you?
excellent. Yes. Yes, that's there. Okay. Yes. So when you say you are feeling uncomfortable during night time, then you have to ask, can't you? Okay. That's there. Okay. Very nice. Others also try. Everyone can try. Okay. This time is for you to practice. and you can ask questions if you have doubts. Okay? Yes. Are the tag questions clear then? Okay. Then I am suffering from severe throat pain. Okay. So now, like, you have to ask some tag questions from me. So what kind of questions you can ask? I'm suffering from a severe throat pain. Okay. Quickly ask the questions. Severe throat pain there. Okay. Yes. Quickly ask.
Are you suffering from severe sorry?
Severe sore throat.
Are you suffering from severe sore throat? Aren't you?
Yes, excellent. So that is about, are you suffering from a severe sore throat? Are you suffering from a severe sore throat? Aren't you? Okay, that's it. Well done. Okay, so this is the way you have to ask. Okay, so what I need to tell you is, students, do not always use one question type when asking questions from your examiner. Use variety of questions. For example, start with a short question, then in the middle ask a tag question. So like when you want to get more information, then ask a long question. So like that, have some variety when you ask questions. Then you can receive a lot of marks there. But I think if you ask what, and can you please tell me, then you will, they will reduce your marks. Okay, because no variety there when asking questions. Okay, but if you practice this method, you have enough time. Okay, so today we are going to cover all the question types. Okay, so if you practice all these things really well, then you can ask them whenever you need. Okay, it will be easy. You haven't taken antibiotics, have you? Very good. You haven't taken antibiotics, have you? Yes, very good. That's correct, Madhuvanti. Yes, that's correct. Okay, well done. So that is about tag questions. Then we are moving on to the last question type, that is indirect questions. Indirect questions are very polite. Okay, so when we think about the video that I showed you at the very beginning, so she used many indirect questions. Okay, so especially
Yes,
she
madam.
used this would you there. Yeah.
Sorry, I had a connection issue.
Mm-hmm.
So I was unable to connect and it was
Okay.
disconnected.
Uh-huh. Yeah, the meeting will be recorded now, so probably you will be
Yeah.
able to catch up this part.
Okay, thank you, madam.
Okay, yeah, yes. So if you have any doubts, like you can just watch the recording. But after watching the recording also, if you feel doubtful and if you need clarifications, we will discuss them next day for sure. Okay? Yeah, no
Okay.
worries. Because we have enough time and we will do this slowly, freely. We are not in a hurry. I know that you all are in different levels. Okay, then if you feel somewhat doubtful or anything there, just drop a message and tell. No worries. Okay, this is your exam, not my exam. Then you should be able to tell me what's your problem. Okay, yes. So then I can understand. If not, I also don't know what you are having. Okay, nice. So this is about indirect questions. When you are moving on to indirect questions, they are really nice. They are very polite. Okay, I should say these questions are very polite than other types of questions. Okay, because you have an introductory phrase there. So, could you tell me? Would you mind explaining? May I ask? Do you know whether? Like that, first we have introductory phrase. Then we use the question word. How long? What? Okay. Then something like that. Okay. Then positive sentence there. So this is not like tag questions. First you have to understand what is the introductory phrase I should use. Okay. So our this is a long question, no? How long have you had these symptoms? No, it is a short, like a very direct answer. We want a very direct answer there. How long have you had these symptoms? Okay. So then you can ask it in a very different way. Could you tell me how long you have had these symptoms? Okay, what happened before you arrived at the hospital? So, like that is something very direct, right? But if you ask this thing, would you mind explaining what happened before you arrived at the hospital? Okay, so that looks somewhat polite, more polite than the first thing. Okay, have you had any similar issues in the past? May I ask if you have had any similar issues in the past? Okay, do you have any family history of this condition? Do you know whether you have any family history of this condition? Okay, just practice these four. That is enough. Could you tell me? Would you mind explaining? May I ask if, or do you know whether? You can use these four types when you ask indirect questions. Okay, if not, I don't know, I am not sure, I would like to know, they can also be used. For example, like now I told you about my severe sore throat. Then you can say, I would like to know when your throat pain started. Okay, so then you can just ask me directly තහන්න පුළුවන් when your sore throat, or or when you can just ask when did it start. Okay, කවද්ද එක start කරේ, when did it start? Okay, then if not, you can just tell me, could you please tell me when it started? So that is okay. Could you please tell me when it started? Okay, so but this thing is very direct, okay, and like somewhat polite. But the second one, indirect questions are, they seem somewhat, I mean, more polite than the very first one. I think you understood it, because when you ask when did it start, and when secondly you ask, could you please tell me when it started? So I mean, that makes sense, right? Okay. Yes. Or would you mind telling me? Would you mind explaining me what happened to you? Okay. Yes. So something like that. So these are the introductory phrases that you can use. Could you tell me? Would you mind explaining? May I ask if? Or do you know whether? Okay. So let's try our best to do this exercise. Okay. So fine. Now this is what we are going to do. I will help you. Okay. So let's try to do this. Where does the patient feel pain? How to ask it? Where does the patient feel pain? Or like just think it like, where do you feel pain? Okay. Yes, that is our question. Where do you feel
Could
pain?
could you please tell me where do you feel pain?
Uh, uh, like, do we use do again there? That is a problem. අපි ආයෙත් do use කරන්න ඕනද? Yes.
No.
No, right? Then how to say it? You have to say, can you tell me where where you
Feel
feel
pain.
pain? That is enough. Okay? Because now we started it using can. If we use again do here, then two question words there. So that doesn't make sense. Okay? So just cut do there. Can you tell me where you feel pain? That is okay. Next one. When did the symptoms start? How to ask it? When did the symptoms start? Okay. Ask it like an indirect question. Send me your answers. When did the symptoms start? Yes, students, how to ask it? You, yeah, you can ask. Do you know when the symptoms started? That can be like said, na? So like, do you know is the phrase here? Can you tell me? Do you know when the symptoms started? Okay, then why did you stop taking medication? How to ask it? Why did you stop taking medication? Any answer? Now you should try this one, okay? You should try this one alone, okay? Can you tell me when the symptoms started? Excellent, that is correct, okay? Alright, let's move on to third one then. Third one එකට යමු. Why did you stop taking the medication? How to make it as an indirect question? Yes. Why
Would you
did you
mind
stop taking the medication?
would
Hmm.
you mind explaining me?
Very good. Would you mind explaining me? Yes, nice.
You stop taking medication?
Okay, would you mind explaining me why you stopped medication? Very good. Okay, that's easy. Would you mind explaining me why you stopped medication? Okay, this one. Is the pain getting worse? How to ask it? Is the pain getting worse? Hmm. Any answer?
Can you tell me
Hmm. Can you tell me?
the pain getting worse?
Yeah, can you tell me if the pain getting worse? Okay, can you tell me if the pain is getting worse? That's how you have to say. Can you tell me if the pain is getting worse? Okay, that thing. Then, did you take any medication today? Did you take any medication today? Yes. Any answer there? Did you take any medication today? Can you tell me? Yes. How to ask it? Did you take any medication today?
Can you tell me you took any medication today?
Yes, can you tell me? Like if you took any medication today? Okay, or like can you tell me you took medication today? That is there. Okay, so always remember you have to start with the kind of can you tell me whether you take medications today? That is also fine. Okay, if not, you can just ask it like something. Would you mind letting me know if you like, or if not, you can say, do you know if you took any, like, or can I know if you took any medication today? Okay, yes. So always use an introductory phrase first. Can you tell me, or do you know, or would you mind explaining me, or can you let me know? Okay, anything, or could you tell me? And after that, you have to make it as an indirect question. Okay, hurry. There is no rule like you always need to use indirect questions when talking. Okay, or when you are doing your role play, there is no rule like you should use all short questions, long questions, or tags or indirect questions. But it is better if you have variety. That is what I wanted to teach you. Okay, if you feel more comfortable asking WH questions, no worries, ask them. But in the middle, just try to include some tag question or one indirect question there. Okay, just try to use them. Okay, that is what you need to do. If not, you don't need to do everything. Like, I mean, you don't need to like tell everything using indirect questions. That is like, I mean, that is not something, I mean, easy enough. Okay, but the only thing is you should be very clear and you should understand what is the question type I should use here. If you need to be more polite, then ask it using an indirect question. Okay, if you need to be somewhat friendly with the patient, then ask it with an indirect question. If you want to know more information, make it a WH and like ask it as a long one. Tag questions, if you feel like the patient is hiding the answer or patient doesn't like to give the answer, then ask it using tag question. Haven't you taken medications? Have you? Okay, like that you can ask, right? Okay. So then, short or close questions, it's better if you can ask them when you want yes or no or very direct answer. Okay. So that's how you have to do that. That is, you should have some variety when asking questions. Plus, try to understand what is the best question I should use in this context? Okay, best question type. Okay, so hope you understood what I told you today. So you have to practice this from 1 to 10. Okay, and I will next day we will do some kind of writing activity. Okay, how many of you feels comfortable when writing using correct grammar? Okay, yes, or do you feel like it's better if we can touch the grammar as well in the class? How about your idea, students? Okay. Is it better if we touch the grammar simply? Or you feel like no need to teach grammar, we are able to move on to writing task? Yes.
Yes, madam, it's better to touch some grammar parts.
Okay. So then let's touch only the sentence structures we need for writing the letters. Only that part, because if we touch from the basics, so the time will not be enough for us, because I need to make you ready within 3 months now. So with the time being, it's harder. So let's touch the most important ones for us to write, and then we'll move on with that. Okay, but you need to write and send it to me. Okay, so always try your best to listen to the recording and then try to find out the things. If it is harder, then drop a message, and then I will send you some other study materials. Then you can go through them and make yourself ready for the exam. Okay, that is all about it. So now these are clarification questions. Okay, so for example, if your examiner says something doubtful, you couldn't hear it, you can say, could you repeat, please? Could you clarify that, please? Okay. Could you explain what you mean by this? Okay. Could you give us an example? Okay. Something like that. So this is about you are asking for clarification. Clarification means that is about you don't understand it, but you want to understand it after asking some question. That is clarification. Follow-up questions. Okay. Then how to clarify your idea? This is a different lesson, okay? I will explain it later, but now I am just touching this. How to clarify your idea? You can say, let me explain about this procedure. Okay. Yes, that's it. Then how to express lack of understanding? So sometimes what your examiner telling is somewhat harder for you to understand. Then you can say, I beg your pardon, but I don't quite understand. Okay, I don't quite see what you mean. Like that you have to say. So me also same. If you feel like what I'm telling is not, something comprehending or something like understandable, then you can say, I don't quite see what you mean. Okay, I don't understand what you mean. Can you please repeat that again? Okay, like that you have to say. Okay, this is about clarification questions. So that is a very different part, but I need to teach you that we have another question type like that. They are clarification questions. Okay, fine. So this is your assignment, and I will be sending you a folder. So what you need to do is you have to record like the question types, and then you have to send it. Okay, record it using WhatsApp or like anything or any recorder. And so only 2 minutes. Role play 1, that is 2 minutes. Role play 2 also 2 minutes. You have to only record the questions. Only record the questions. Questions විතරක් record කරන්න. The questions that you are going to ask from the patient. Okay. So have some variety. Okay. And yes, don't ask everything using WX. So like again, watch this role play. Okay. There are many role plays like this. Okay. We will do them. Just access this. Try to understand how it is happening. And after that, record these 2 role plays, role play 1 and role play 2. Okay, so the first one is about that stomach pain, other one is complaining of a severe headache. Okay, so very easy situations they are, as it is the very first day of the class. Okay, but step by step we will move on to the difficult ones as well. Okay, so that is what I wanted to teach you students today. That is about the question types. Okay, now I'm going to send this presentation to you. Yes, I will send it after the class. Okay, fine. Any doubts there? Or you understood what we completed today?
Yes, ma'am. We
Yes, you
understood.
understood. Okay, very good, nice. And if you have
Good,
any doubts, then drop a message at any time. Drop a, like messages, I mean, group पे क्यों ना कमक ना है, you can just send you a message or you can just ask you a question there, no worries, at any time. Okay, then we will wrap up the lesson and next day we will do writing. Okay, bye everyone. Stay safe.
Bye, madam. Good night.
Bye. Thank you very much for joining. Bye. Stay safe.
Thank you, madam.